To the very first episode of Ask a Longevity Doctor, where I put your questions about health, wellness, and longevity to a medical profession. So my name is Chris Curwen, and I'm going to be the host today. I am a cell and gene therapy student at the University of College London, and I'm also a research analyst for Gowing Life. And I'm here today with Dr. Oliver Zolman.
Hello.
So if you want to give yourself a little introduction.
So, I'm Oliver. I'm a medical doctor, currently based in Cambridge in the UK, and I'm founder of 21 Consulting, which is a longevity research and consulting company. And we're focusing on the emerging science of slowing and reversing the fundamental aging process in all 78 organs in humans.
And today we're talking about the levels of longevity. As always, if you guys have any questions, please pop them in the chat and then I can get to them at the end. So Ollie, why don't you give us a bit more of an introduction and sort of tell us how you arrived at the levels of longevity?
Yeah, so I guess it was mainly through my injuries during medical school. So I had like a lot of lower back injuries, and I was kind of paralyzed for over a year. And I went through like all the GPs, all the specialists, sports doctors, orthopedic doctors, physiotherapists, personal trainers, and no one seemed able to help. And I ended up having to do like a lot of research into the literature to find what works for me. And it just kind of made me question the whole efficacy of the healthcare system. And that was like that experience that I had for like 1 or 2 years in the first year of med school in London, combined with my interest in regenerative medicine and stem cells. That's kind of what led me to creating this whole longevity strategy, which we can talk about a bit now.
Yeah, when you first introduced me to the levels of longevity, it really struck me as such a good way and logical way to sort of put them together. So why don't you sort of go through the levels and give us a little bit about each of them?
Yeah, sure. And if you have any questions as I'm going through them, let me know. So there's 3 levels. First one, we'll go through each one a little bit. First one is basically lifestyle. And you can actually reduce your risk of dying from all causes. So that's called all-cause mortality by at least 50%, just by lifestyle. So that's pretty crazy because it has a huge effect on lifespan. So for someone that does like the lifestyle components in level 1, like perfectly, versus the worst possible unhealthiest person you could be, like you're a chain smoker and everything, you're going to live like 30 years longer. So this is actually like slowing both the fundamental aging process a little bit just for the lifestyle, but also what we call the accelerated aging processes, which is where like if you're a smoker or an alcoholic, you're going to have accelerated aging compared to what's normal. But yeah, level 1, basically you have a 95% chance of reaching age 75 and a median life expectancy of 94, which is about 13 years higher than most developed countries. It's kind of more close to Monaco, which I think is is a very small country, but I think their life expectancy most recently, or still about 10 years ago, it might have gone up even more. Theirs is about 90. So it's even above Monaco's life expectancy if you do level 1. And then level 2, it doesn't really change your median life expectancy, but it will increase your certainty of reaching that median life expectancy. So you'll have a 95% chance of living to an age higher than 75, so up to age 92, in theory, depending how well you do level 2 interventions. And then it's when you get to the level 3 stuff that you can start really having a moderate or major impact on the fundamental aging pathologies in different organs and organ systems. And yeah, there's no limit in biology to how effective that could be in terms of health span and lifespan. Any questions there, Chris?
All very clear so far.
So basically the goal of level 1, 2, 3 is it's a societal goal. So it's to generate evidence very quickly that we can reduce people's biological age in all of their organs by doing this level 1, 2, 3 protocol in 10 years, basically. So and we're targeting 80-year-old people in particular because they're the people who are at highest risk. So people who are age 70 plus now, they're the ones you're going to see the benefits of level 1, 2, 3 in most. But it's important to understand that level 1, 2, 3 works for everyone, even children. Because obviously, if you have, obesity or exposed to secondhand smoke as a child, that's going to accelerate your aging even as a child. So yeah, the protocol applies to everyone. We'll skip through some of these, but yeah, basically, I first published this kind of strategy in Aubrey de Grey's journal, Rejuvenation Research, in 2018, and presented it at the Undoing Aging conference in Berlin there as well. So it's based around a new medical specialty. So that there's no current medical specialty that's optimal for deploying this protocol for patients. And I call this medical specialty longevity escape velocity medicine, or LevMed. And basically what LEV, or longevity escape velocity, is the time when medicine's getting so good that it's adding more than 1 year to your expected healthy life expectancy per year, which means your lifespan becomes indefinite. And I think that currently it's around 0.25, but it's increasing either linearly or super linearly in terms of how much life expectancy we're gaining each year longer that we live. So like for example, if you're healthy enough and you survive to a certain age, then by that time technology will be so good that it increases your life expectancy way more than you think it will.
So yeah, what's going to be that critical point that we all live to, and then after that, the technology will just take us on forever?
Yeah, pretty much. If everything keeps going according to plan, and there's no Corona 2030.
Fingers crossed.
Yeah, fingers crossed. But yeah, we go through level 1. So level 1 is 6 things. And as you can see, they're arranged in order here. So the top one is, so basically all these numbers are the amount of lifespan, which is mostly healthy life expectancy, that you can gain if you're doing the best of them versus the worst of them. So if you're a chain smoker versus, like smoking 25 a day versus a never smoker, then it's going to add 12 years to your life expectancy. It's crazy. It's so much. So no drug can do that at a population level currently. Then we have exercise. So that's moderate and vigorous exercise in particular. And that's up to 8 years. So that's actually more powerful than the other components. So that's huge. So if you're doing no exercise, you're losing 8 years off your healthy life expectancy. Then we have calorie restriction. And this is, the evidence is strong for this in men, but less so in women. And it could be because men eat more calories than women already. So the RDA for men is about 2,500. And for women, it's about 2,000. So women are already eating 20% less calories. But when we look at the monkey studies and the human studies and on the biomarkers, we can see that it kind of normalizes the difference between genders in terms of lifespan. So there's like 10 times as many female centenarians as there are male. And my hypothesis for this is that it's partly because they have been eating less calories over their entire life. So that's an important one, especially for men. All of these stack on top of each other as well. So like I was saying, the total gain you get for these is about 34 years or 30 years, compared to if you do all of them for the worst to all of them to the best.
So would you expect, say if a man ate or stuck to 2,000 calories a day, for instance, do you think they would experience that sort of the same lifespan as a woman would tend to experience?
Yeah. So male life expectancy, especially once you start getting past age 80, 85, 90, then the proportion of healthy, functioning and surviving females to males is a lot higher. And yeah, so calorie restriction will definitely help with that, based on the male monkey lifespan studies, where they had the longest living monkeys ever, and also the crazy biomarker data that you see in humans, which I've got a slide on later actually. But yeah, it's not going to make you live to 120. The simulations estimate about 3 to 7%. So 5% is kind of like a reasonable midpoint of that to suggest.
Our glut is our downfall. Yeah. Carry on.
Yeah, and then we've got diet. We've got a checklist on that. Show briefly next. BMI, that's body mass index. So the normal range is 18.5 to 25, but 18.5 to 22.5 is a bit better. And then wine also as well. Well, ideally wine, but it could be any alcohol. But red wine or rosé wine are probably the best when you're looking at all the observational evidence and randomized control trial evidence together.
Is that something particular they've got in them?
Yeah, so the alcohol itself may be a little bit helpful, because it has some like anti-clotting benefits, maybe mild hormetic effects where a little bit of bad is good for you. But like if you're doing vodka shots every day, then that's associated with quite a strong like esophageal or cancer risk. But if you're doing wine shots or a small glass of wine, then it's more like there's no cancer risk for wine. There's just no evidence for that at this dose.
Wine shots for the win then. Yeah, I think that's going to be, I think we'll definitely do an episode on this later, because I think that's a really interesting topic that a lot of people must hear about. So yeah, we'll definitely dive a bit deeper into that, I think.
Yeah, so the first thing you should think about when you're thinking about your health is basically level 1. So there's not really, it's the best bang for your buck, and it's super cheap. Like most people save money by doing level 1. So you're going to save money if you're a smoker. Like if you're a smoker spending £2,000 a year on cigarettes, then that's so much money you're going to save. Same with alcohol. Alcohol is very expensive. If you're eating less calories, you save money. Diet, there's not really anything expensive in the diet checklist. And yeah, diet's linked to BMI. So you normally save money by doing level 1. It's not very time intensive to do. Exercise is the most time intensive part of it, and maybe meal prepping. But you're kind of going to be doing these things already. And you're also, when they become habits, it becomes automatic. So you don't really perceive it as, effort, time spending effort. But yeah, you should always think about when it's your health, like how much of level 1 you're doing. So I'll show one little bit on level 1, which is the diet. So this is like level 1 diet checklist, and it's got 10 things. So 6 of them are about increasing certain dietary behaviors, and then 4 of them are about decreasing certain dietary behaviors. So as we can see in the increasing one, there's nuts, omega-6 and omega-3. And one way of getting that like quite easily is just by eating walnuts. So like 30 grams of walnuts a day would cover 3 of these aspects in level 1 diet already, because nuts would cover that category, and there's a good omega-3 and omega-6 content and ratio just in walnuts. So that's like one of the simplest ones you can do for level 1 diet.
It's such a tiny change in lifestyle, isn't it, really?
Yeah.
Just a few grams of nuts is nothing.
Yeah, and like each one of these things, if you divide it equally, on average, for the average person, would add around, half a year of life or 6 of healthy life to them. So those walnuts arguably could be 1.5 years just from eating walnuts each day. But yeah, it's quite useful, this slide, because you can see what you need to do ideally, but also it shows you, so you could do 2 of these things not at all, and you still gain the benefits of the plus 5 years.
And this is a table which is up on your website, is it?
Yep. So this whole presentation is on the homepage of my website.
Brilliant.
oliverzolman.com. Great
little plug. Perfect.
Yeah, we'll skip through all these because it would take a couple of hours to go through it all. We'll focus on the main takeaways. So level 2, so level 1, you get a 95% chance of living age 75 to 98. But then level 2, you're kind of like increasing your chance of being in the top half of that amount. So it won't make you live longer than 98 because you need to reverse the fundamental aging processes to do that. But it'll make you healthier and more likely to reach age 90 plus. That's the point of level 2. And this is where like all the things, all the random things in medicine and healthcare, I just like throw them in. So there's 12 categories. It's quite a lot. One key one, which a lot of people will understand or have experience with, is sleep. So obviously, if you're sleeping bad and you have insomnia your whole life or sleep apnea, that's really going to increase your risk of heart disease. But solving sleep isn't, you don't have to reverse your aging process to solve sleep. It's all like different interventions which aren't related to reversing aging. And that's what level 2 is all about and why it's called additional interventions. So things like, CBT for insomnia or CPAP or all these sleep apnea interventions, these would all be level 2 therapies for sleep because they're solving a level 2 category problem.
So why wouldn't you put, say, maybe sleep in level 1, or what's the difference between between level 1 and level 2, I suppose?
Yeah. So the requirement for level 1 is it's got to have evidence that it gives at least 2 years gain in life expectancy for the vast majority of the population. So there's not, basically for all the level 2 stuff, there's not enough evidence that these things will do that. So yeah, for most of the population, if you have the best sleep you can versus the worst sleep you can, we don't have enough evidence to say that will add 2 years guaranteed almost to your life expectancy. But we do for things like alcohol and smoking, all these things.
So it's very much, I mean, that makes sense that it's strength of evidence, definitely.
Yeah. So another interesting one on this level 2 is solving medical conditions and using PubMed. So point 11 on there. So a lot of the reason people don't live to, point 11 and 12 are kind of linked. So point 12 is your testing routine. So that's blood tests, imaging tests, and device tests. So an example of a device is a blood pressure cuff or a scale. There's some very simple ones. But the reason a lot of people don't live to age, like they do all of longevity 1, but they'd still die at age 75. One of the most common reasons is these points 11 and 12. So they don't do routine testing and pick up things at an early stage when they can easily be cured, or they don't act on those routine test results appropriately. So they may find they have something abnormal, but then it's managed incorrectly by their doctors. And also, a lot of people, there's a lot of medical conditions. There's like 50,000, most of which are genetic, but there's at least, there's thousands or 10,000 or so quite common medical conditions which people could have. And people, if you're having these over the years for decades and decades, then it's going to affect your aging. So if you have any medical condition or injury or anything that isn't normally an age-related condition, these can often accelerate aging in different organs anyway. So you're going to have accelerated aging and make you age faster. Say you have like eczema, which isn't really a fundamental aging disease that's caused by the aging process. Then your skin aging, and maybe your immune system as well, may age faster if it's not treated correctly. So there's going to be a lot of benefit from really solving all your medical conditions, and also solving them as best as the evidence allows, because a lot of the time clinicians, even specialists, are several years behind the latest studies, unless they're an absolute specialist in like a niche area. There's always like multiple randomized controlled trials that they miss. It's quite hard to believe that that's a thing, but there's just so many trials now that it's really hard to keep up if you're not a niche specialist in a particular area. It's 50,000 randomized controlled trials a year. So it's very hard to keep up, because often there's a lot of those that's relevant to your condition, even if you think it's not directly relevant as well.
I mean, yeah, there's a huge amount of data there, isn't there, that you have to keep track of, even just to be not even above board, to like, and sort of have a well-rounded knowledge of everything that's going on. It's just so much to keep up with. But I mean, what you're saying there is that through, or what I think that you're getting at, is that if you do look at the aging and treat aging as a sort of disease, then it will have an impact on many other areas, like you said, eczema, and any other ailments that you might not have sort of think is a concept of or a result of aging. But so many of these things will get solved with our treatment of aging as a disease.
Yeah, well, it's the other way around. So like, if you have these conditions, then it will accelerate your aging beyond the baseline.
Okay.
So, yeah, if you have autoimmune conditions, or like type 1 diabetes, for example, is a good example. It's not really an age-related disease, but if you have it, it'll accelerate the aging of all your blood vessels, for example, and then your blood vessels' biological age of that organ would be older than if you didn't have type 1 diabetes for someone of the same chronological age. So yeah, level 2 is basically personalized precision medicine. So personalized, I mean, like, it's really tailored to the individual's medical history, and really involves the patient themselves. And by precision, I mean that then it's tailored to their biomarkers, whether that's blood tests or whatever. So like level 2 diet, for example, that's where we're monitoring the levels of every vitamin and mineral to screen for deficiencies and insufficiencies, and doing dietary interventions to get them up to the optimal range for health. So that's one example of how biomarkers can be used in level 2. But yeah, that's level 2 as an overview. And then level 3, we can skip forward to here. So this is the fundamental aging processes. And these are basically 9 things, 9 categories with subcategories as well of aging processes that go on in your body, and normally they accumulate exponentially or so. So a lot of the risk from aging occurs when you age 70 or 80 plus. You don't have a risk of dying from an age-related disease when you're 20, because the risk is very low. So it's like a straight line, and then suddenly it jumps up like this once you get past age 60. And that's when all these 9 things on the slide, they also start, a lot of them start accumulating exponentially like that as well. So as soon as you have a little bit, then it leads to faster growth of it having even more of these pathologies in your body. So the rationale here is that you have to address all of these all 9 categories and as many subcategories within them as well, to start reversing the fundamental aging process. And what's interesting is that in each organ, you may age at a different rate. So there's about 78 organs in the body, and some of them may have, very little of this pathology of these 9 pathologies. Some may have a lot of all of them, and then some may have more of category 7 rather than category 4, just because the way you're aging personally. So it's quite a personal, everyone's more similar than different, but there's also quite a bit of personalized aging in your organs. So you take one 80, 90 or 100-year-old person, and then you look at all 78 of their organs, and then you look at another person, and you may find that the biological age of this person's heart is 95. It's really bad. And this other person who's been cycling their whole life, maybe it's about 60. So there could be huge differences within organs.
So really, to find
how you manage them,
to sort of figure out someone's biological age, you really need to know the age of each individual organ to get a true depiction of sort of what state of health that they're in.
Yeah, and it's quite complex to measure specific biological ages. So for the heart, like we were just saying, for example, you'd want to use a combination. So ideally for any organ, you use a combination of biofluid, device, and imaging tests. So to measure someone's biological age of the heart, biofluids you want to do would be stuff like BNP and high sensitivity troponin I or troponin T. That kind of increase with age quite strongly. Could do cholesterol as well, but that's more the arteries than the heart itself, you see. Then imaging wise, you'd want to do an echocardiogram, and ideally an exercise echocardiogram, and you get so many markers from that. You could also do an MRI or functional MRI of the heart, and you could do CTA, where you look at the how much plaque is in the coronary arteries. But again, that's the arteries, not the heart. So you have to think about them as separate organs, because the arteries are throughout the whole body, and they will age in a similar way. But the heart itself ages differently compared to the arterial cells. And then device tests, of course, you could do ECG. And then you combine markers from all 3 of these to predict the biological age of someone's heart. And it may be that they're different parts of the heart. They're kind of you could argue the heart's multiple organs because, in some ways, because there's just so many different cell types. But yeah, you could see that maybe someone's conduction system in the heart is older than someone else's, but their ventricles and muscular system is actually really good. So there's different parts within the heart that could be older or younger as well within the same person.
Now we're delving very deep into the diagnostic, I love, but I'll bring it back to the sort of the hallmarks of aging. Essentially, is what they're in longevity level 3. I mean, they're very, very interconnected, aren't they? There's telomere attrition can cause cellular senescence. And that can cause, multiple things to go wrong in the cell, and intracellular communication can be affected. So all of these things are very interconnected. So I guess this is almost one of the best frameworks we have about thinking of aging. But we've still got a hell of a long way to go, I suppose, to actually figure out, is there an underlying process to all this? Or is it a culmination of each of them?
One sec, go grab my phone.
Yeah, no, go for it. I think Ollie's gone off to grab something. I'll just have a look through the questions here. So we have got some questions coming up.
Yeah.
I think just actually I might point out at the moment. So I think what we'll do, the structure of the series. So we'll have a few episodes in the series. The first episode, like we're doing now, is very much sort of giving us an overview of the longevity, the levels of longevity. And then I think for the episode 2 and episode 3 and episode 4, we'll dive into individual aspect of each of the different sort of levels, picking out a particular topic to sort of deep dive in. So if you want to stick around for that, but I'll hand it back over to Ollie to finish your sort of general overview of the longevity levels.
Yeah, so it's important to note that my level 3 is based on this. So it's combining the frameworks of Aubrey de Grey and Maria Blasco and Lopez Otin. So there's 2 key papers basically that came out in from 2007 and 2013. So there's the SENS, the SENS 7 deadly things that build up in the body and cause aging, which is Aubrey with the beard at the bottom, his framework. And then there's a group of scientists that many which worked with Aubrey and then built on this idea as well, 6 years, and published it 6 years later, called the hallmarks of aging. And there's 9 things in there, but there's some redundancy between them, and some of them basically when you combine them, and you also add in stuff that the hallmarks of aging missed out, which is useful to include, like extracellular matrix stiffening, the scaffold between cells, damage in that area. You get these 9 things with lots of nice little subcategories that you can focus on in my level 3. So yeah, that covers all the levels.
Perfect. Well, yeah, thank you very much for that. I'll quickly go to a question in the chat from Kayan. She asked, what happens when someone changes lifestyle habits? How long does it take to undo all the damage? For example, it takes 4 years to change all of the cells in the body. Is it the same for longevity, or is it slightly less or longer?
Yeah, so it'll depend how much damage there was initially. So if you're a chain smoker, smoking 25 cigarettes a day for years and years, decades, no amount of lifestyle is going to reverse all that damage. So you're still going to have, the studies show you still have residual risk, even if you start adopting the healthiest lifestyle possible, the level 1 stuff, then it's not going to be enough to undo all the mutations, all the molecular damage that you've done from those thousands of cigarettes that you've smoked. So level 1 isn't powerful enough to do that in extreme cases. But then on the other hand, level 3 stuff would be powerful enough. So one crazy example would be that you 3D bioprint lungs, replacement lungs, which are genetically matched and aged 0, so they have no aging damage. And then you transplant them into the chain smoker who has, localized lung cancer and COPD and everything. And then suddenly you've done it. You've fixed all the aging pathology in that organ in particular. So yeah, you need level 3 stuff to really reverse all the damage for everyone. That's the same for everyone. But little bits of damage you can reverse with level 1 and level 2. In some cases, like quite a lot. Like if you have an ongoing condition which you find a solution for, that can really improve the health of your entire body.
Very well. Yeah, thanks for that. That was a great question. So thank you, Kayan. So yeah, I think from that really, what I first want to talk about is your first step. I mean, it can be quite daunting to look at the levels of longevity and apply them to your own life. And what's a way of really taking that first step? Is it to look at your own life from the perspective of longevity level 1, go through it and say, okay, what am I doing here, and what can I change to sort of optimize it to the longevity levels? Is that what you'd first do, or is it something slightly different?
Yeah, so what you want to do is you want to go to level 1, to the slide in the presentation. You want to print it out ideally, and then you want to find the thing in level 1 that you're not doing the most of. So you want to find your worst level 1 thing. So if you're a smoker, then that's going to be your priority. So for me, for example, I do all of these. So I don't smoke. my diet meets the checklist requirement. I do the wine, I do the calories, I do the BMI. So the only thing that has changed this year for me is the exercise, because it's been a bit harder with lockdown. So, I've lost those habits that I had, like I do easily. So yeah, I've had to make changes to my exercise. So it's always like first principles, like it's like health. Where do I start? It's so like with any patient really, you can use the level 1, 2, 3 protocol. Even if they come in for any disease, obviously not in an acute state, but any chronic disease presentation, you're thinking, what's their level 1 compliance? Because level 1 is going to affect pretty much everything in medicine, in someone's health. And then you're like, okay, that's the priority. So we could do this niche level 2 thing or level 3 thing, but they're not even doing the level 1 things yet. So we want to focus on the key part of the level 1 that they're not doing and make it really easy and support them to do that and bring about sustainable behavior change and habits and address all the barriers to them adopting this behavior.
So it's very much working your way up the ladder, I suppose. And I think it's very important also to say that if anyone does want to try this sort of thing, do talk to your doctor first. And there is a medical disclaimer as well on Ollie's website. But yeah, that is, I think, is a very important point. But yeah, so on to the next question, which was, does the age at which we implement the longevity levels, does that affect the impact it will have on us? So say I'm 70 and I've lived a mildly unhealthy life, say, and then I really go ham on the longevity levels. Is that going to have as big of an impact as if a healthy 20-year-old started it then?
Yeah, so it won't be as much impact, but there'll always be some. So even if you're age 90 plus and you start doing exercise for the first time, and you do it in a safe way where you're not at high risk of causing a fracture, because you've probably got osteoporosis as well. But yeah, as long as you start implementing these safely at any age, there's a lot of studies that show you still gain benefits in health outcomes. So that's like risk of diseases and also biomarkers. So whether that's like blood pressure or cholesterol or glucose, these kind of things. So yeah, the younger you do it, the better. Even like under age 18. So you don't want to do, these are all adult recommendations. So you don't want to do calorie restriction before age 18 or 21 or even 25 maybe. But like the exercise, diet, BMI, and smoking, if you're doing that for like most of your childhood, you're gonna be a lot healthier and not, of course, permanent aging damage that could be impossible to reverse without level 3 therapies, compared to someone that's smoking 25 a day, not exercising, eating purely junk food, and it has obesity.
I guess when we're talking about young people, I guess it's good to get into good habits. So when you get to above 25 or then you can sort of implement these without having to change your lifestyle too drastically.
Yep.
I can imagine for some people it would be a really drastic change in lifestyle. What do you say to these people that just say it's too much? I haven't got the money, and I know you said it can actually be cheaper to do it rather than not. What do you say to these sort of people?
Yeah, so it's really about small, tiny changes, tiny habits. That will work for everyone, like tiny changes. And then there's like a spectrum of people. There's a spectrum of like how much you can change within a certain amount of time for people. So some people you can just you tell them to do something and they'll do everything immediately, and it's just crazy. Whereas others, it's really hard to get them to start eating nuts, like a few nuts a day, because I don't know, whatever. So yeah, the answer is you've got to use evidence-based behavioral change techniques for clients or patients. So that includes like having support networks, education, resources, like expert guidance, personalization, triggers, to remind them to do stuff, all these things. So there's quite a lot of things you can do in behavioral science to make stuff easier.
Yeah, I'm definitely a sort of someone that needs to have triggers in place to
So
need to do things.
Need that alarm each week.
Exactly. Yeah. Tiny things like that can make a huge difference, I find. And I'm one of those people that's very binary in that sense. I have to be doing something, and if I start it, then I'm fully going for it. But then the sort of flip side of that is I can just be a complete sloth and not do anything. So yeah, it's getting into the right habits and having those triggers put in place for when you do sort of change a little bit, then you can get back on the straight road.
Yeah, diet is very habit related. But with all of these, there's like a lot of barriers you're going to face. So, smoking, there's like the actual biological addiction processes going on, and you may need drugs to reduce those, whether that's nicotine replacement patches or other anti-addiction drugs like varenicline. Basically my point is like you got to predict all these barriers in advance, like as a clinician, and you've got to be able to troubleshoot all these barriers. So like with exercise, you've got to become a personal trainer as a clinician, or you got to find a personal trainer for the person to go to, or a physiotherapist. So like injuries are so common. If you're going from no exercise up to any amount of exercise, it's really, really common to get injured because you start doing too much, tendon injuries, sprains, strains, etc. So yeah, like physiotherapy and injury prevention and injury recovery is a huge one in exercise, because that's most of the stuff that holds you back once you start it. Getting past the habit stuff, then it's like you physically can't do it because you get injured so often. And then there's like same with diet. There's a lot of people like don't know what to eat, or there's like certain foods that's gonna like just stop them doing everything and give up. So you have to become a dietitian as a clinician, or refer them to a dietitian who is familiar with this type of protocol. So you have to deal with stuff like low FODMAP diet, food intolerances that aren't FODMAP related. So that could be stuff like lectins and autoimmune conditions, or just too many carbs, or ketogenic diets, like all these things. You have to know lots of different types of dietary interventions to really make this succeed. Even though that level 1 slide is quite simple, it's like, stop eating red meat, eat walnuts, eat more vegetables. In reality, it's like really complex and takes weeks and months to get someone to do that if they're not doing much of it.
Yeah, no,
you got to break the barriers to each one of these.
I can definitely imagine that. Yeah, I think so. If we zoom on up the longevity ladder up to longevity level 3, so these are the interventions which could be game changing if once we master them. When do you think some of these interventions we see in longevity levels 3 start to become a more regular part of everyday life for the general person in the general population?
Yeah, so if we go to the level 3 slide, so we see a category 1 on a category 1 and 2. So category 1 is like lost cells. So you're losing stem cells over the years. So certain stem cell types, they decrease like over 100,000-fold, 100 or 1,000-fold by age 100 plus. So you just got like no stem cells left. And then the second category, get rid of excess cells. One of those is cancer. So cancer is a fundamental aging process. In category 2, it's one of those subcategories. So then we can look at the state of stem cell therapy and cancer therapy today, and it's been around for decades, if not a century, in the case of cancer already. So a lot of level 3 therapies have been used for decades already, and are mainstream in society. We just don't realize that we're actually treating a fundamental aging process effectively, because like there are many cancer cures out there, and there's more and more in the pipeline all the time. So 5-year survival rates for cancer, which is for adult age-related cancer, are nearing 100% for many cancers out of the 200 or main cancers in developed countries like America. And that's crazy because it's a fundamental aging process. So we can see in this little slide here that the too many cells box, so that includes cancer and these zombie cells that build up in your body, senescent cells. So like maybe 20% plus of the cells in your body can be zombie cells, which are causing havoc in the body by age 80 plus. So that's like, it's kind of like a cancer which doesn't divide, but it does induce nearby cells to join the zombie army. So it's kind of like, it's similar but different to cancer. It's like way slower, like because most cancers are quite fast compared to senescent cell buildup. But both of them do spread, which is interesting. So senescent cells will make neighboring cells, which are healthy normally, become zombie cells and join the zombie army, just like cancer cells will divide themselves and become that way. So they're both very similar, and you have to use chemotherapy or equivalent. Like drugs which kill cells to get rid of them. And yeah, we've got loads of effective cancer therapies. We've got across chemotherapy, radiotherapy, biologic therapy, surgery, and screening. And we're starting to see a lot of trials come through for anti-zombie cell drugs, senolytics, as well. And then same with stem cells. We've been using stem cells. It's like one of the oldest medical interventions for like leukemia or bone marrow failure. Is you do a bone marrow transplant, and what that is, it's really a hematopoietic stem cell transplant. So you're doing that stem cell therapy by taking a young healthy person, normally, taking their bone marrow or their blood stem cells and then injecting it into someone else who's had their immune system wiped out because their immune system was all messed up. So that's a stem cell therapy that we've been doing for decades already. And then there's a lot more coming through, and stem cell therapy is a huge, multi-decabillion industry now every year and growing like super fast. Like I think the compound annual growth rate is over 25% for cell therapy and stem cell therapy. There's a lot of evidence-based clinics you can go to for certain stem cell therapies, particularly musculoskeletal. Mm-hmm. There's a lot of randomized controlled trials showing that these outperform standard care a lot of the time.
I'm holding myself back from asking or going deeper in these because this is what I love, and this is the part I want to dive deep into. And for anyone who's listening and who listen to you talk about zombie cells and stem cells and don't know what they are, then we'll definitely do a deep dive into that. So stay tuned into later episodes for that. But for now, we'll keep it fairly general with the longevity levels. So do you have anyone at the moment that you're taking through the levels of longevity?
Yeah, so I've had it's still quite a new concept. So 2018 is when I first created it, and it was really only last year, 2020, when it turned into the levels format and made it really practical to do. So basically the way I do it is like we've been saying, you start with level 1, see what's going on there, like how much of which one they're doing, explore the person's ideas about why they're not doing it, their beliefs, concerns, etc. And then once level 1's out of the way, which can take like 6 months, then you start doing level 2 stuff. Because it's like 80-20 rule, Pareto principle. Most of the benefits you're going to gain for most people is in the level 1 stuff that they're not doing. So if they're not exercising, then there's going to be so much gain you're going to get from that in terms of health benefits and quality of life, rather than focusing on, do I take this supplement or review this weird level 3 therapy for me to see whether I should experiment with it. That's not the priority. You got to start with level 1 stuff, which is the priority in everyone in the world, pretty much. So yeah, I've taken a few people through. It's basically advanced like a very advanced health coaching thing. So in theory, it would be nice to see, because like there's a limited number of medical doctors and clinicians, but it would be nice to actually have non-medical doctors. They could be trained to provide this service and take them through this like 1, 2, 3 protocol as well, as then it's more scalable, as it's quite hard. It's important to have the human factor, but it's quite hard to get that when you need a doctor doing 30 minutes a week and giving you homework kind of stuff.
And we sort of, the general population go to see their GP and want to talk about this sort of stuff with them, which I'm sure a lot of people would. Do you like how well sort of read would the general GP be on this sort of stuff? Is longevity and the world of neuroscience something that they have to keep tabs on, or is it something that maybe some people do, like yourself, too, because they're a bit more specialized?
Yeah, so obviously in med school and postgraduate training, you learn about pretty much you learn about pretty much every age-related disease through the lens of disease classifications. So you won't learn about senescent cells and all the level 3 or even stem cells. You won't really learn about that, but you'll learn about how to manage osteoarthritis, how to manage heart failure, how to manage atherosclerosis, heart attacks, strokes. All these are age-related diseases which are caused by the level 3 pathologies building up in the context of an old person. So you learn about all that, and you're always staying up to date with that from new guidance, like NICE guidance in the UK, or conferences or courses, or continuing medical education credits, or continuing professional development credits. And you're also required to as well through revalidation in a lot of countries to show that you're staying up to date with the latest science. But yeah, I think there's also a type of specialists also specialize in age-related diseases. So arguably a cardiologist who specializes in old age cardiology is really a longevity doctor, a longevity heart doctor. There's also geriatricians, which is a medical specialty where they're kind of like the GPs of old age. But the problem with that is that you can only access them in secondary or tertiary care. So in a hospital, you can't really. I don't know of any geriatricians that you can. Well, there's very few that you can go to discuss level 1, 2, 3 kind of protocol. Normally you'd have to see like 10 different people. You'd have to see like a nutritionist. You have to see a nutritionist or dietitian or nutritional therapist or a personal trainer, and then multiple GPs to deal with your smoking and alcohol problems, and a smoking cessation specialist nurse, alcohol specialist nurse, Alcoholics Anonymous, smoking CBT apps. It's like yeah, there's no medical specialty that would cover everything that you need to cover.
Yeah. Amazing. Well, I think that is all we've got time for today. I think we'll wrap it up there. So yeah, thank you so much, Ollie. That has been absolutely brilliant. Is there anything you want to get a quick plug in at the end with, your website or anything?
Yeah, subscribe to the YouTube channel so you can keep up with the new episodes coming out. And yeah, sign up on the website as well for more notifications on guides and video resources that we're going to put out about level 1, 2, 3.
Yeah, I completely implore everyone to go and have a look, check it out themselves. So thank you so much for listening. Also, go and check out the Gowing Life website, where you can find out about all the latest news and updates from the world of longevity at www.gowinglife.com. So yeah, without further ado, we'll stop there and we'll see you next week. Thanks very much.
See you soon, Chris.
See you then.